Hi, everyone, and welcome to this episode of Dogs Unknown. I'm Sarah Fraser, joined by fellow host Brian Burton. Today's episode is all about separation anxiety in dogs. This is absolutely one of the most common reasons that folks might reach out to a dog behavior professional for help. It's also one of the issues that can be truly one of the most stressful, sometimes almost feel debilitating. It can have a big negative impact on welfare on both ends of the leash. Despite it being a really common issue, I think separation anxiety as a behavior issue is often a little bit misunderstood when it comes both to the factors that can contribute to why it's happening in the first place and also the ways to treat it or help improve it. So today we are very privileged and a little intimidated to be joined by a totally powerhouse guest lineup to help us clear up some of these misconceptions about separation anxiety and share with listeners more about what it really is, why it happens, to the best of our knowledge, and what treatment or intervention often looks like. So today we are joined by Malena DeMartini, who is a certified dog behavior consultant who has been specializing in separation anxiety for more than 2 decades, which is amazing. She is an established author and speaker on the topic. She is creator of a separation anxiety certification program for dog trainers and has lots of resources available for dog owners as well. So Malena, welcome. We are so grateful to have you here to lend us your knowledge and expertise.
Thank you, Sarah, and thank you, Brian. I'm really happy to be here with such amazing guests and the two of you as well. So I'm honored to be part of this.
Fantastic. Good. And then we are also joined by Dr. Emily Levine, who's a board certified veterinary behaviorist, vice president of veterinary behavior at Instinct. She's owner of the Animal Behavior Clinic in New Jersey and co-owner of Instinct Northern New Jersey. And she is also author of Doggy Do's and Don'ts, which is a super cute and lovely dog or a book on dog safety for kids. So if you have little ones, there's the plug. And then we are also, welcome Emily, and we are also joined by Dr. Chris Pachel, who is also a board certified veterinary behaviorist and our other co-VP of veterinary behavior at Instinct. Dr. Pachel is owner of the Animal Behavior Clinic in Portland, Oregon, and co-owner of Instinct Portland. He's also a renowned lecturer and presenter on a whole wide range of companion animal behavior topics. And we have him at home today, which is a rarity because Dr. Pachel is always out traveling.
Yeah, always.
Yeah. Helping
we're in the process of opening up Instinct Portland this month. And so, it's all hands on deck at home right now. So this is where I get to be. Thanks for having me.
Absolutely. Yes. So we are so excited to have you all here. Thank you for joining us. And just really excited to have this conversation about what really can be just such an incredibly challenging and I think impactful issue for so many dogs and owners. So starting off, because we didn't really define it at the outset, what is separation anxiety? Are there times when an owner might think that their dog has separation anxiety when they don't, or vice versa? Is it one of those things that like when you know, like when you have it, or not so much?
Who do you want to take that, Sarah? We've got 3 amazing voices on here.
I want you to all jump in and talk over each other all at once. No, I imagine you'll each have, I imagine this will flow a little bit back and forth, but if we wanted to maybe pop in and have Dr. Pachel, since you chimed in first with asking who wanted to go first, would you like to take the first stab at defining separation anxiety for us?
Sure. Yeah. So by definition, I mean, we're often looking at a negative emotional state or an animal's experiencing a level of distress or panic, specifically in the context of being alone or separated from their bonded caregiver. And there's variations on a lot of those terms that we can come back to. And that is just one of the separation related behaviors that we can see, which is where it gets tricky, right? Just because something is happening exclusively or predominantly when an animal is left alone, that doesn't automatically mean that what they're experiencing is separation anxiety or separation distress. So getting video and really understanding context and body language and response to interventions and all of those things is really important to do before we dive into that assumption of, okay, this is a dog with separation anxiety, and now what?
Perfect. And what I'm hearing there is it's a collection of behaviors. There's overlap with those behaviors in dogs who may not have separation anxiety. So it's more about a collection of behaviors and the reason why those behaviors are happening. And why is that important when we think about, like maybe you have a dog at home who's just really bored or having an amazing time, like shredding up the carpet because that just has a super fun activity for them. Why is it important for folks to understand the difference?
I was just going to say, I think with any behavior, but with separation related behavior problems specifically, we need to understand the function of the behavior in order to arrive at the correct intervention. And so if we've got a dog that is literally anxious and phobic about alone time, that is a very different function than the function of I'm so having fun ripping up the couch cushions right now, right? And those will be very different looking interventions. And so I think it's super important that we look at the whole dog and all of the body language associated with alone time and determine whether it's truly alone time, whether it's just concern about confinement, or whether it's I'm barking at the people walking by out the window, and therefore I'm vocalizing a lot. So it is really common that we talk about the three big symptoms of separation-related behavior problems of elimination, so urination, defecation, vocalization, and distraction. But there are differentials for each of those that, a dog might not be properly house trained, or a dog might be vocalizing at external stimuli, or a dog might be bored and chewing on those couch cushions. So we need to understand the underlying behavior, not just the outward manifestation.
But I think that's super helpful for people. And Dr. Levine, did you have additional thoughts to add on that front?
No, I completely agree. We have to understand the why of the behavior to know what to do about the behavior. And I also want to, for all the dog owners who are out there listening and who are living with a dog who's exhibiting behaviors that are problematic or concerning when left alone, the most important thing that I want them to hear is that you are not alone. There are so many people going through this. And so while I know we're going to be talking a lot about the nuts and bolts of separation anxiety, there is definitely a lot that can be done for it. And it is normal to feel stress and distress and even a little bit of resentment sometimes towards your pet. And I just wanted to say this at the out front so people know that you are in good company, that this can be stressful and all those negative feelings you might be feeling are totally normal. And there's hope.
Absolutely.
Yeah, absolutely. Well, and I think that leads us nicely into, again, as sort of stated at the outset, and I think reinforced by you there, Dr. Levine, is it really is one of the most common reasons that folks contact us as behavior consultants. And I would suspect it's one of the more common reasons that folks reach out to you as veterinary behaviorists, Dr. Pachel and Dr. Levine as well. How common is this as an issue, is separation related behaviors? And is it more common than it used to be? Or are people just more likely to reach out for help? If we think it's more common than it used to be, perhaps decades past, like why might that be?
I think this is a really important question in the now, because I've done a lot of news media interviews, and everyone is saying, oh, we've got this separation anxiety epidemic. And honestly, I think there are so many things that have contributed to what looks like an increase in this behavior issue that may not be that the issue is starting to be more prevalent, but there is a level of awareness now that has never been there previously. And even just a few years ago, pre-pandemic, there was not the awareness that there is now. And then if we look back 5 or even 8 or 10 years, we did not have in-home cameras. And so a lot of these dogs were going unrecognized because people would drive into the driveway and the dog would stop barking or stop doing whatever because the individual was home. And so the problem was going unrecognized. And now people are intensely looking at their dog's behavior when home alone and recognizing everything from the most subtle indicators to some of the more egregious and outward indicators that are very problematic to the client, to the owners. So I think that we are seeing big numbers, and the research indicates, above 17% of the companion animal dogs, at least in the US. But it depends on the research that you look at. Some of the research studies show much higher prevalence. So it is, I think, quite a welfare issue, not just for the dogs, but for the individuals that are caring for and loving these dogs. And I'm so glad, Dr. Levine, that you mentioned that people are not alone in this. I know, as a practitioner of doing this for 20 years, 10 years into my practice, I adopted, irony of all ironies, a dog with separation anxiety. And I know, so from both that professional and that personal standpoint, what it feels like to be on the other end of that, and feel overwhelmed and hopeless and frustrated and sometimes angry. And those are all very, very valid feelings to have.
Yeah. Yeah, absolutely. And I love that sort of just that nod to like people just have so much more visibility into their dogs at home alone lives than they ever have before. And certainly if it was a dog who maybe was displaying, I mean, even if they were having elimination issues and someone just might assume like, oh, naughty dog, you're not house trained yet.
Right.
Or destructive behavior. But there's lots of, I think we can say, dogs who have separation related distress who don't display those. They may vocalize and they may do a whole lot of drooling or panting or shaking and waiting at the door, and an owner just would never have known in the past. So
and I think
love that.
It's so cool that you point that out, because I think it's been a beautiful thing to see that the clients, of course, that are reaching out to us, many of them are saying my dog is destructive, or I'm getting complaints from the landlord or, the neighbors or whatever. But many of them now, and this is new within the last 5 years, many of them now are reaching out and saying, my dog is pacing and drooling.
Mm-hmm.
And that is not an inconvenience per se to the dog owner, but they are concerned about the welfare of their animal, because they can see that overwhelming level of distress when there's a manifestation that's happening physically, like drooling or urinating or panting excessively. I think people are starting to recognize that and realize what a concern that is.
Certainly. Dr. Pachel, Dr. Levine, do you have other thoughts in addition to it potentially just being a more visible issue than it was in the past because of furbos and other cameras that people use to watch their dogs at home? Are there indicators or reasons that we might think, even if maybe they're not affirmed in research, that we feel like contribute to, just a situation in terms of dogs' lives in our current society that would make separation related issues more likely to manifest or to occur?
I would say yes. And again, we're right on the cusp of getting some additional research coming through, and this kind of comes back to our understanding or our presumptions even about why some of these issues actually happen. Why is this, 1 in 5 or more dogs are experiencing this? And so we're looking at dogs as a social creature. I'm going to shy away from calling them a pack animal for all of the reasons that, it's not exactly what it looks like in terms of those sorts of things, but they're very, very social, right? They establish bonds. Those bonds can be a source of security or comfort, especially when we get into attachment styles and some of the research that we know from kids and some of what's being done now in the separation anxiety world as well. We know that companionship can be a source of safety and security. And so what we also have to remember is that animals, dogs included, adapt to their current conditions in many cases, or at the very least, they recognize this is what's familiar to me now, right? And again, various levels of adaptation, sometimes successfully, sometimes not, but they're experiencing something within their daily routine. And sort of the elephant in the room is, the last couple of years have been anything but routine. And whether we're talking about some of the dogs who are now, let's say, 3 years or younger, who were brought into homes and didn't actually experience much in the way of actual alone time, versus those dogs historically where that may have been a part of the Monday through Friday, the 9 to 5, or some degree of work environment or work routine. And so the learning history of the current youngsters, the current adolescents, in many cases is different. And we know that learning history impacts behavior as well, not only in terms of setting them up for what they're comfortable with or not, but also setting them up to experiencing anything that's new or different from the norm as potentially a source of stress or distress. And so, we've got all of these animals that as people return to work, or at the very least just changed their world around, that is something that can absolutely manifest as a separation related problem in a variety of ways.
Yeah. Well said. Are there others, Dr. Levine or Malena, that you wanted to add to that?
One of the things that might be on people's mind is, did COVID really have an effect, on these dogs? And I think, like both Malena and Chris have already said, there are multiple reasons why we could be seeing more of these cases: increased recognition, changes in environment and how often we're home. And there was an interesting study done in Italy looking at puppies who were raised during critical socialization time when Italy was under very strict social parameters to not go out. I mean, way more strict than in the States, I will tell you. And the puppies who were raised during that very restricted time did show an increase in fear and anxiety issues, as opposed to those puppies who were raised outside of those very strict COVID times in Italy. So while I think I'll only speak for myself and with informal conversations I've had with colleagues as a veterinary behaviorist, I don't feel like I've always seen a lot of separation anxiety problems, always, my whole career. So while a lot of us don't feel like we're seeing that much more of it, we think people are recognizing it more. I do believe that there are going to be dogs who are at an increased risk given their early environment if they weren't able to develop independence and social relationships and all those necessary things a social animal needs to develop. So do I think COVID is impacting some animals more so? Yes, I do. I think that's just another element in there to consider.
Yeah. The other thing too, just to ask, because I know just with people listening, so I agree with all that. And sometimes when people reach out, and I don't want to derail us too much, but sometimes I have people reach out and they'll say, like, what's the difference between separation anxiety that we're talking about? Or like recently people are starting to use terms like isolation distress. So I know we talked about, like, because sometimes they'll say, like, oh, do I even qualify to get this type of help if I have isolation distress versus separation anxiety? So is that distinction important?
Yeah, I agree that it's important. And I'm glad you asked the question. I think that the labels that we use for a dog that is experiencing distress about alone time are far less important than addressing those underlying, anxious, big feelings. And you're right that we're hearing isolation distress a lot more. And I think that the distinction is interesting because actually in the research, there are a lot of terms and terminology used to describe dogs that are experiencing anxiety about alone time. And actually a lot more than one might expect. And funny enough, isolation distress is not one that is recognized in the research, but it is in popular language. And I think that we commonly use the term separation anxiety as a bit of an umbrella term for dogs that are really distressed about being alone. And the distinction and the nuance of each individual dog, because every dog is indeed an individual and experiences this anxiety in many different ways. The distinction can come in the treatment, where one dog has some sort of nuanced aspect to their behavior when alone, and maybe one person is the important person versus just any warm body will do. And that's where that distinction between those two terms is coming from. But distress is distress, is distress, right? And so if there is home alone anxiety and big feelings about it, we need to start with a treatment intervention, regardless of the label that we put on it.
I would both agree and disagree with some of the things that Malena just put in. And she and I have had this conversation before, so I'm like dying to dive into some of the things that we've chatted about. When I think about labels, I think when we're looking at the medical model of behavior, I think there are relevant details based on the label that we put on things. And so, I would say the three that I tend to reach for most commonly, at least in my style of practice, would be separation anxiety, separation distress, or isolation distress. And again, that I'm sort of moving the confinement issue off to the side here for just a second. The reason I tend to reach for those three the most is that for me, they really capture three different patterns. And again, as Malena said very eloquently, the literature is kind of all over the map with all sorts of agreement and disagreement about terminology. And that's not just separation anxiety, folks. It's all over the map in terms of behavioral therapy. But the things that I look at is that if I have an animal who's experiencing a negative emotional state or a panic response when they are alone versus the animal who is anticipating or showing that apprehensive anticipation of threat in response to pre-departure cues, or even just the morning on a Tuesday is enough to create distress, they're not alone yet. And so the way in which I look at those two patterns is that I may have an animal who's distressed when they're alone, and that may be because they're separated from their individual. There's a bonded caregiver who's not present versus, as Malena said, though any warm body will do. And so what I'm looking at is this an animal who needs to learn how to be separated comfortably from their person? Is this an animal who needs to learn how to be comfortable truly when alone or when isolated? Is this an animal that we're focusing only on the actual period of isolation, or is this an animal where we also have to address some of those pre-departure cues and some of the other signs of anxiety? So for me, it really comes into both my interventions from a training standpoint, as well as how we address them from a management standpoint. And when we're thinking about that, right, if we've got a dog where any warm body will do, cool, maybe we can use daycare, we can use pet sitters, we can use some of those other patterns or some of those other support networks, versus the dog that really needs to be with their person. Some of those crutches that we can lean on in some cases just aren't going to be helpful. And that really affects how we move forward in our understanding for that individual, as well as what we have the opportunity to do to support them through that treatment.
Yeah, I would agree with you, Dr. Pachel, but I think the one thing that Brian said that is important is that I want any owner that is listening to this now to know that whether they feel it's isolation distress, whether they feel it's separation anxiety, if the dog is experiencing these big feelings about whether it's just departure or whether it's departure plus alone time or it's just alone time, they are certainly eligible and ready and hopefully in pursuit of getting some help with that.
Yeah.
Yes.
Yeah. And I think that they will find this conversation relevant to them regardless.
Yeah.
And I would be curious to hear if someone's like, I don't know, like maybe it's one, maybe it's the other, maybe it's both. Like, can it often be a mix of a dog who maybe has isolation distress, but also they're really attached to and they have a hard time being separated from their primary caregiver as well. I would guess like lots of behavior issues, there's not these really lovely clean cut lines with lots of cases and lots of dogs. So if someone's listening and this feels fuzzy, it's probably because it is.
Yeah, in fact, I can make it fuzzier. So I can take it one step further from even maybe what has been discussed already. So for me, that umbrella term of anxiety is so unhelpful when I'm first looking and meeting a dog. Or by the way, other species can have this too. But I generally, until I get in there and know more information, I just sort of refer to these things as separation related behaviors. Because when I am looking at a dog who may be engaging in a variety of behaviors, I'm trying to understand what part of the neurobiological system is being activated when they feel these negative feelings. So for instance, a lot of dogs may exhibit anxiety and or panic, and most people will know that can be the dog trying to escape or pacing and panting and urinating. but it's also very possible that they're feeling elements of frustration. And so that frustration behavior may be, a lot of people out there may recognize that if they try and leave, but their dog may grab a body part or try and bite them to prevent them from leaving. And that would be, to me, a classic frustration related behavior, because all of their other attempts, pacing, whining, trying to body block, may not have worked to keep the person in the home. So they escalate, and because they're frustrated. So I think there are lots of different flavors of separation anxiety, if we want to use that umbrella term. And I think there are a lot of also mixed emotional states that are likely going on in the animal, which is why there's no real cookie cutter approach. Because I think when people hear this out there, you might find people, all you have to do is teach your dog to sit and stay and eat a cookie. And don't be disappointed if that doesn't work. If it works, fantastic, and thank your lucky stars, Probably it wasn't a true distress situation, but there are so many different flavors of it and so many different emotional states involved. And, where I do think the terminology also is helpful to know, just from an ease of solution, is like if it's just barrier frustration. There are plenty of dogs we see who, the only thing I tell them is leave them out of the crate and the dog's fine, because so many dogs just don't like to be confined into small spaces. And I think, from my perspective, and this may be controversial, I'd be curious to hear what the other panelists say, but I really do not enjoy crates for my separation anxiety patients. It is such a source of distress for them. So I'm often like, because so many people are being told, well, just dogs are comfortable in their crates. Dogs are comfortable in their crates. It's not so inherent. And so many dogs, it makes the problem so much worse. I'm all about get them out of the crate. So if a dog truly just has barrier confinement, like I just don't like to be in a small, tight place, which I can relate, just let them out. And sometimes if you let the dogs out, they're totally fine. Sometimes, and often the cases that I see, I should say most of them are not fine. It's not that simple, so to speak. But there are dogs where it may be as simple as that. So I think that is a term that I think is important to think about when meeting a dog.
Yeah. Well, that's great. And I know we'll talk more about solution stuff later. So basically, to sum it up, is the reason why I asked that is, if you feel confused about the terms, we can see why. Because it's like the research is sort of all over the map. We're all using different terms. And I know I've had people who are almost sheepish, like talking to me and using certain terms because of what they read online. So thanks for that, because I just wanted to make sure that, people just, if you need that help, get that help.
Yes.
So,
and if you're not sure, I think the reason even why we're talking about this broadly is separation anxiety. Don't be shy to say, hey, I think my dog might have separation anxiety, because that sort of collectively right now is the term that most folks are familiar with, and let a professional help you sort of guide through and tease apart, what are we actually looking at here?
Yeah.
Like, never feel shy about saying, I think my dog might have separation anxiety,
right.
To describe, them having
Definitely.
to be left alone or whatever that might look like.
Definitely.
And yes, we'll absolutely get into some of those maybe common advice that folks might receive that might actually do more harm than good, and also what typical treatment might look like. But I'm glad you flagged that early, Dr. Levine, as a one of those potential pieces of advice that can sometimes backfire for dogs with separation anxiety or separation related distress. So before we move into what can folks actually do about this, what does treatment or intervention look like? What does success look like? What do timelines look like? All that good stuff that I'm sure people are wondering about. I do just want to talk briefly, or have people share their thoughts on, like, what are some causes what do we think are some causes, or what do we know are some causes, or maybe some increased risk factors for the occurrence of separation anxiety in dogs? Maybe on the flip side, what are some common myths about what causes separation anxiety? Because I know for a lot of people listening, and just as dog owners who really love our dogs, typically when a behavior issue exists, we're really quick to say, I must have caused this somehow. This is my fault.
Mm-hmm.
And so I would love to hear from you all, what are some actual risk factors maybe that we see, and what are some myths?
Well, that is the biggest myth right there, that you've caused your dog's separation anxiety. And if anybody listening to this takes that away today, that they should absolve their guilt, that they have somehow created this perfect storm to create this behavior problem. I know that there are many, many bits of advice out there, like, only pet your dog or give your dog attention if they are exhibiting appropriate behaviors, or don't let your dog sleep in the bed, and don't let your dog up on the couch, and don't give your dog too many treats or bring them on outings with you as often, and those sorts of things. And it's interesting because we know a lot about what does not cause separation anxiety. Well, we don't know a whole lot about the actual causation. We know a little bit in the past, just maybe 7 or 8 years, about some genetic implications, but even that is rather unclear insofar as, is it, or is there genetics plus environmental influences plus epigenetics and so many other things. And so I don't know, even in the pandemic, right, when people haven't been leaving their dog alone for much, if at all, many of those dogs were okay. So we can't say just not leaving your dog or just letting your dog sleep in your bed, or any of those are directly causational with separation anxiety. And I think it's important for everyone to hear that, because boy, the number of clients that I've worked with that are bursting into tears on the very first phone call saying, my neighbor told me that I've caused it, or my mother-in-law told me that I've caused it, or a host of people, right? And I don't think that is true nor helpful. So please absolve your guilt about the fact that you have created this actual problem.
Yeah, well said, Malena. I think that when you said we know a lot of things that don't reliably cause it, but we're not exactly sure what does, I think that there's the nugget right there, right?
Mm-hmm.
Like there's a lot
Agreed.
of things that, I think the people who are like, oh yeah, no, my dog sleeps on the bed, so therefore it must develop separation anxiety, or I love my dog too much. I don't think there's such a thing as loving your dog too much and therefore expecting that they're going to have an anxiety disorder. It's just not that simple. With that being said, animals are constantly learning. So, while I think we can get rid of our guilt for that by saying that there's a direct cause and effect, we also know that the way that we interact can matter. So how we respond, especially during some of the early developmental phases of puppies' lives, and whether they are actually learning how to, well, just like people, are they learning how to navigate stress? And do you have coping strategies for what you do when your world is not perfect around you? Or do we have animals where that panic or distress response kind of takes on a life of its own? Which unfortunately, especially as we're talking about separation anxiety, if this is something that has been a repeated experience for that animal, that perhaps they were a little bit uncomfortable the first time they were left alone, and then it was a bad experience because they were alone, and then the next time the owner leaves them alone, they're a little bit more sensitive. And so we get this sensitization and maybe even generalizing pattern. And it doesn't take all that long. In some cases, just a handful of experiences, or even one really traumatic experience, to create a conditioned emotional response where the dog says, wow, that was really terrible. I need to make sure I can predict what caused that and never let that happen ever again in my future, or at the very least, express my distress physiologically or behaviorally to try to get myself out of this situation and back to a place of security and safety. So there's a lot of ways that we could arrive at a place where an animal is experiencing that distress response. It's just not a one cause or a one size fits all sort of a formula that gets us there.
Yeah. And I think that's I love that. And I think that's what we share with folks a lot, is that you certainly are the path forward, right? 99.9% of the time, it's not that you necessarily did anything wrong. You could do the exact same thing with a different dog and arrived at a very different outcome.
Yes.
But now that we're at this place, let's look at the unique needs of your totally unique dog and figure out what we need to adjust to help them. Right? So you didn't do anything wrong. We just may need to do things differently moving forward based on what we now know about your dog and their needs.
Yeah, it's interesting because people we seem to, in our culture, like, oh, you're a dog and you should love me and you should be okay being home alone because I give you food and water and play and what could be wrong. And we seem to forget that they are actually living being creatures with genetics and environment. But my last dog was fine with this. And it's no different than when for people who have had children, let's say biological children, same husband, same wife, you have multiples, the kids can come out completely different. It doesn't, and what strategies you use with one child may be completely different than what you use with another child. So I think it's really important also to remove that sense of guilt this is an individual. And as you said, Sarah, so eloquently, you are the path forward. Let's just figure out the best way to move forward.
So I'm hearing, I think, so we can't just say that leaving your dog home alone on a Sunday at 2 p.m. is what causes them to have separation issues. We can rule out some things that don't cause separation anxiety. Like Malena, I think you mentioned a few about, say, maybe like, or Dr. Pachel about like dogs being allowed to sleep in the bed or greeting your dog when you first come home or when you leave. Have I missed any that we already shared there that are sort of some of those myths about things that definitively cause separation anxiety? I know those are big ones for me that I think people cling to.
The spoiling, loving too much, or the spoiling that you mentioned.
Yes. So hopefully that feels like a little bit of, I guess, a relief for people to know that, you can lift that weight off of your shoulders. And I think that is a nice opportunity to transition into, if you've relieved yourself of some of the guilt that you didn't cause or create this issue, it's still happening. It's still really stressful for the human and for the dog. A lot of times, and we'll talk about this a little bit further along in the episode as well, but a lot of times there can be time pressure with this issue, sometimes more than others. If someone lives in like an apartment building or a condo and the dog is vocalizing as part of their distress, there can be a lot of time pressure to resolve the issue as well. Plus, just depending on the level of distress, like it is hard to see your dog feeling that much panic or worry or agitation like that. It's hard to see, especially when like, I get it. I have to go live my life, I have to leave them, and I'm putting them in this situation. Like, it's a really challenging, emotionally tough issue. So I guess I would like to move in now to like, what do treatment or intervention options look like for collective umbrella term separation anxiety? Because I know they can vary within, and this is a tough question as well, but what sort of timeline is involved in seeing improvement for dogs? And I would love to go through this. Like maybe Malena, you can share a little bit about what separation anxiety intervention looks like with a certified separation anxiety trainer, which is the program that you have created, and how might that differ from some other common treatment approaches?
Yeah, I think the thing that is important about working with a behavior issue like this is that we have the opportunity to adjust criteria in a quick and dynamic way. And when people work with a certified separation anxiety trainer, they are in communication and getting notes and feedback and collaboration 5 days a week. And that allows us to not only have these touch points where we can dynamically adjust or catch something that is maybe positively or negatively impacting the animal, the learner, and then adjust quickly and make those, to allow for that efficiency and training. But I kind of also want to say that one of the things that we do is take the client guesswork out of it. And I think that's really important because this is an overwhelming process. I know personally, and I'd been doing it 10 years when I adopted my separation anxiety dog. And I was like, oh my gosh, I don't know what to do. And people, of course, laughed at me and said, aren't you supposedly an expert on this topic? Why don't you know what to do? And it's different when it's your own animal and the emotions that are involved there. So taking the guesswork out of the equation for the client, I think is really important. And we meet with our clients once weekly virtually, and then the other 4 days a week, we are interacting in a shared log. And that is sort of like our holy grail of information that is so great when we are collaborating with VBs and veterinarians, because we can say, here was a condition change. For instance, here we started a medication, and this is how that is affecting this animal in day 1, in week 1, in week 4, etc. And we can see those changes in real time. So the process that we follow is simply exposing the animal in very small increments to alone time and teaching the animal that alone time is safe. And I will say that, separation anxiety, if we're using that term, is actually not a unicorn. So in a way, right? We're talking about fear unlearning in this, and best practices for fear unlearning include minimizing or eliminating the exposure to that stimuli, in this case alone time, and then exposing the animal in very, very small and gradual increments to be able to safely tolerate alone time moving forward. So it's so funny, because I want to say that it's I always refer to Bob Bailey for this. It is simple but not easy, right? And that's where a trainer and a professional like a VB really comes into play, because while it's simple, it isn't easy, and we need to guide people through on a day-to-day basis with that.
And so thank you. That's very helpful. And I think if someone isn't familiar with, Malena, I know, well, you can tell me if I know. I think I know. One of the most common sort of, I think, pieces of advice, or maybe early treatment options that folks are recommended when it comes to working with dogs with separation anxiety, is using some combination of maybe really high value food, doing a type of sort of counter conditioning, along with those gradual exposures to being left, or larger exposures to being left alone. And it's my understanding that that's not something that you all do as part of your certification program. Do I understand that correctly? And maybe you can tell us a little bit about why, if that's the case.
Yeah. Well, in answer to that, the first thing I have to say is that I have been practicing for over 20 years, and I will shout from the mountaintops that food is typically the most efficient and effective means to acquiring behavior. And so, I say that, and then I'm going to tell you that we don't typically use food with separation anxiety dogs. So that's kind of a funny dichotomy, right? I will say that there's a number of reasons that in the early stages of a separation anxiety protocol, we don't use food. And that, the biggest one, there's the obvious ones. Many dogs that are distressed won't eat. So that is just a non-issue to provide them with food, but when they're distressed. But the goal here is to allow the dog to experience alone time that is safe. And when we really lean into watching that dog's body language, one of the things that happens when we are providing a food stuffed toy is, if the dog will eat, they are distracted in engaging in that toy. And, oftentimes people say, well, but we're building a conditioned emotional response to the person leaving. And while I understand that, there are some concerns with that, because number one, the order of events is wrong. We wouldn't give the dog food and then present the scary thing of alone time. And so that is really important. But I think the bigger issue is, if we're going to carefully observe a dog's body language and know how they are experiencing that alone time, having the distraction from a body language perspective of that in that food toy can lead us down some incorrect paths. One of the most common calls we get is, my dog is okay for about 5 or 10 minutes and then he freaks out. And I typically want to say, oh my gosh, I know what the answer of the next question I'm going to ask is, but I'm going to ask it anyway. Tell me what happens at that 10-minute mark. And the individuals typically say he runs out of his food. And so I think that one of the goals that we're trying to accomplish is teaching the dog safety And then later on, we're happy to introduce food if that dog needs some enrichment and entertainment during alone time. But in those early stages, I want to know every nuanced detail about that dog's body language and how they're experiencing alone time. And the last thing I will say about food, I have some fascinating video. I mean, we've collected video for a long time now on these dogs, and so many of them are having conflicting motivation. And what I mean by that is that they are eating while showing signs of distress. And so just the fact that they're eating does not necessarily mean that we are keeping that dog under their panic point. I know personally, I am happy to cry and be anxious while eating my bowl of mint chip ice cream, right? Like, it doesn't make me not experience those emotions. And so I want to keep from muddying the waters in the beginning of a protocol by not incorporating that food and not also poisoning that cue where, by which we mean food equals an absence that is longer than you can handle. So I think those are the main reasons.
Thank you for clarifying that. I think that's super helpful for people to hear. And I'm sure we'll hear from Dr. Pachel and Dr. Levine in terms of instances where they might, or even where we might use food in certain situations with separation anxiety or separation related behaviors. But I think it's really helpful for people to hear that. And what I'm hearing is the process that your certified separation anxiety trainers are using with that very systematic desensitization process and those teeny tiny exposures, food can get in the way of that procedure that you all are following. Yeah.
I agree.
And
yeah, it can.
And then, so I think that's really helpful for people to hear. And then Dr. Pachel, Dr. Levine, from your standpoint as veterinary behaviorists, what can your sort of collection of treatment options look like? Where's the overlap? Where's maybe where are things different? Because I know the other reality here is that the two of separation anxiety, like trainers and behavior consultants and veterinary behaviorists work together quite often on these cases and collaborate. And thank goodness, because it often does take a team approach.
Indeed.
Yes. But yes, I would love to hear your all's thoughts in terms of what treatment or intervention can look like.
Yeah, I love some of the things that Malena that you mentioned there about really focusing on the level of support for clients, kind of demystifying the interventions, just really creating that roadmap. We did this was the response, really creating specific recommendations. And that's something that I see from my clients who are working with a certified separation anxiety trainer, where they feel a lot more confident in the interventions because it's so tangible and so practical. There's also a core element to that program, which is don't leave your dog alone unless you're working through a departure mission. And that is, I will be very honest, was not the way that I was initially trained to treat separation anxiety. It was, if you can do that, great. You'll probably make faster progress and we'll be able to work on this regardless. And I would say that still does hold true for the patients that I'm evaluating, and even that we've got a lot of tools and a lot of approaches that we can employ for these dogs. One of the first questions that I do ask my clients is, can you temporarily or in the long term, can you actually avoid leaving your dog alone? If the answer is yes, then following that CSAT program is absolutely one of the tools that's available to us. And if not, if you're going to have to leave your dog alone for whatever reason, whether that's time or budget or resources or whatever it happens to be, then we're going to have to do some other things, or at least additional things, because if we're continuing to leave your dog home alone some of the time and they're experiencing panic, that's going to absolutely interfere with that goal that you just mentioned so eloquently, which is teaching your dog that time alone is safe. Right. And so when we think about anxiety and a lack of predictability, oh my gosh, there's almost no faster way to create anxiety than to create randomized experiences for the same conditions. Okay. So, I really love the fact that when we're able to really make it crystal clear, avoid or suspend those departures and create safety, love it, love it, love it. And for the clients who say, but I can't do that, maybe I can at some point, but not right now, we have other options as well. And in some cases, that may be a time where leaning on food or some other reinforcer may be good enough in the short term to start to mitigate some of the panics, or at least the animal, again, I'm not saying this is the ideal, but maybe the dog is kept busy or occupied throughout the length of the departure so that they're not displaying some of those problematic behaviors that might get that owner kicked out of their apartment. Right. So we might be going down that pathway, or we may be reaching more for medication support a bit more quickly to say, gosh, what are the different ways that we can create safety? One is never leave them alone. Another would be to potentially find a successful medication protocol that at least temporarily buffers that big feelings, emotional response that's driving the bus for some of those problematic behaviors. So we can do a lot of different things there. Are those as good as truly suspending departures and creating safety? I don't know. Depends on the individual dog. But I think that's where we can really look at this as sort of a flow chart of saying, what are the options? What tools or what resources are available to you? And how do we put those together based on the unique needs of your animal and figure out what's an option, at least as we get started?
I love that overview. And I think it also just, it, I think also highlights indirectly just the fact that the separation anxiety as an issue is sort of unique, and the treatment of it can be sort of unique. And Malena, I think that's, part of what's so neat about the program that you've created is that it is one of those rare issues where some folks do have the ability to actually control exposure entirely. Whereas if we're dealing with something like, for a very broad, clunky term, like leash reactivity or conflict aggression or things like that, almost impossible to completely control and rule out exposure to situations where the dog might be like, quote unquote, over threshold. But separation anxiety is kind of unique in that regard for a certain segment of folks. And I love, Dr. Pachel, what you highlighted is, but if you're not in that certain segment of folks, you absolutely can still, get help and seek treatment and see improvements in your dog. But I love that part of it of like,
me too.
Yeah.
And I think one of the things I want to add is I think earlier in my career, I was more likely to make the assumption that nobody can not leave their dog home alone.
Mm-hmm.
I just jumped to the conclusion, like that's an unrealistic thing to ask of someone. So I'm not going to go down that path. And I think I got a little older and more gray hair, and I think become more reasonable in my older years. And that is one of the things I'm always going to start with is like, is that actually possible? Because if so, I do agree that's a much better path to go down.
Just like we tell people, hey, don't walk past that dog whenever you
Yes.
like.
Right.
We are comfortable doing that in lots of other circumstances. And I think for some reason, this idea of like, truthfully, of, well, just don't leave your dog, but it's not just,
Yeah.
right?
That's right.
But we put a just there. Well, but just don't leave your dog home alone is for some reason like, oh, we can't ask people to do that.
Yeah.
But we actually can.
Yeah, I feel that we can. And you're right, Dr. Pachel, not everybody is able to. I don't know if you all know, I happen to be a kind of a geek when it comes to data, and I collect a lot of data, and we're kind of embarking on some research here. So it's going to be some fun stuff coming down the pipe. But pre-pandemic, I took a year's worth of data of the number of people that reached out to us about their dog separation related behavior problem. And there was over 2,000 people that reached out to us in 2019. And of those, 50% were already suspending absences, not leaving their dog alone for longer than they could handle. There was an additional 30% that when we explained to them and also respected their lives and said, we get it. This is a big ask. We get it. But reminding them also that this is a temporary ask. This is not 15 years or more of your dog's life, that this is for the duration of the training. We ended up with about 80%, a little over 80% of those 2,000 plus people that were like, oh, I get it. Yeah, we can absolutely do this. So I think I share that information because I think you're right. We are a little squeamish about asking people, but I think that people are very willing and interested in pursuing that avenue when possible. And they just need to understand the why and understand the temporary aspect of it.
Yeah. Yeah, no, I appreciate that. And I think that reflects, like I said, my sort of journey there. And the reason why I bring that up, and so whether it's the 1 out of 5 or 2 out of 5 or 2.5 out of 5 people who really can't do it, I'm sure that's going to depend on environment, like what kind of job you have. Is your dog reactive to other dogs so they can't go to daycare? Like there's all these different factors that can play in. And I tend to get a lot of like at Instinct at East Harlem, if people can suspend it, there's trainers who do that, and I tend to get tossed a lot of the cases where people can't suspend stuff because I tend to be okay working in the mud and trying to figure things out. And I will say that's where we absolutely lean on the vet behaviorist, like Chris said, or the veterinarian, because like we have to get there quick. And I will say I do use food in those cases, and I think there are times where yes, I don't think it helps, but I think there are many times in those situations where like if we keep track, how long does it take the dog to start eating food? Did they eat the food? And then if they start barking afterwards, how long is the duration of the distress afterwards? Because a lot of times we'll actually start to see like a decrease in that, and it can eventually go away. So I just wanted to throw that out there where like I agree with all the caveats, and that's what's so nice about long form. There's so much nuance here. Like, am I going to jump right to a stuffed Kong? No, I do think there's cases where I don't think we would have made progress in a reasonable amount of time with someone if we didn't have that food, and if we could have,
because of the circumstances of
because
their
the circumstances that they lived in.
Right.
So I just wanted to throw that out there in case anyone's using food. Like I don't think it's necessarily like a bad thing, but I really
No.
appreciate the nuance here.
And I will say there are also times, and these cases are like lovely when they happen, when we do sort of the trial. It's almost like you have to leave, you're having to leave your dog alone anyway. You're not currently providing, say, like a high value food resource, and you're waiting for your veterinary appointment. Let's try to leave them some high value food and see what happens. And if over the course of like 5-10 exposures, they're improving, like amazing, let's continue to build on that and still work with the vet behaviorist. And if they're not, that tells us something too. And it tells the client something too about the level of the dog's distress and where they're at and what we might need to do moving forward. So I feel like it can also almost be like a nice temperature check almost in certain circumstances.
Yeah.
Not all the time, but
Yeah,
Dr. Levine, I know we've been chatting a lot, and I know you have thoughts.
I do have thoughts. I think big picture is it's nice to know there are all sorts of different ways we can help our dogs, but everything in me is just feeling for those people who are in the category if you can leave your dog alone, fantastic, do it. But if you can't, there is still a lot that can be done. The vast majority of my career, people weren't willing, unable to leave their dog alone, and we still had success using medications. Medications are often so important to stop dogs from panicking. So important. And for people who are out there listening, if you're concerned about using medication in your pets, one of the most common concerns is I don't want a dog who's drugged up, who's out of it, who's lethargic. And neither do we. It defeats the whole point of what we do. We only use medications when we're really trying to enhance the quality of the life of a pet. And I would say for so many of these dogs, when the right medication and the right dose is found, it can really be so tremendously helpful, and sometimes pretty darn quickly. And I would also say that it's not uncommon that one medication isn't sufficient. It's not uncommon we have to cocktail, because and this depends on the clinical signs we're seeing in the animal. Because if you have an animal who's low-grade anxious all the time, I'm going to follow mom and dad around all the time because I'm anxious, but then bam, we panic the minute they're out of sight. We have to target different areas of the brain for that. And the more aggressive we can be with that type of treatment up front, we can then, hopefully, if all goes well, start to wean back a little bit. But we first have to get the animal to understand that this is a safe place. So sometimes we have to be a little bit more aggressive up front with meds to get them to that calmer place so that they can start to learn whatever training path you're going down, because there are many, different ones. And I just really feel so many dogs are suffering needlessly because of this hang up about medications, when sometimes it is just so helpful and so needed and can be temporary, especially for those people who cannot leave their dog alone. It is a kind thing we can do for them. And I just want people to hear that.
I love that you brought that up, Dr. Levine. And I think that it was actually one of the points that I had. It was kind of a question for you all. It certainly is my impression anyway, just personally, that it feels like separation anxiety of a certain intensity more than almost any other behavior issue that we work with. I don't want to say requires behavior medication to be on board, but holy cow, is it a difference maker and a fast one at providing relief. And like, it seems to align really well with providing dogs with relief in when they're faced with absences. Am I just experiencing confirmation bias because that's something I thought and then my belief gets reinforced, or does that reflect your own experiences at all? And if so, like why? Why do we think that's a case with this issue in particular?
Well, I would and then I'll let someone else speak, but it certainly reflects my clinical experience such that when I am meeting someone with a dog with separation related issues, I will say 90% of the dogs we work with improve. Are there some that don't respond to any treatment? Absolutely. But the numbers are in your favor for things to get better. So that is my clinical impression too, because that's been my experience for 20 years. Now I'll defer to someone else.
I would absolutely agree with that. And again, I think this is where, what's the saying? When you change the way you look at things, the things you look at change. Mm-hmm. And so the lens that we're looking through is going to create some of that confirmation bias. And so for someone who is a prescriber like myself, well, I have immediate access to be able to prescribe. And so I'm more likely to do that. And so I'm more likely to see the response to that. I also have an education that allows me, in most cases, I would argue, to prescribe thoughtfully and intentionally, because I've got a pretty big toolbox. I know that that's not the case for a lot of general practitioners, even those who are really interested in behavior. They may have 2 or 3 options, and beyond that, they're kind of starting to flail a little bit. And I say that without judgment or criticism. It's just, all medication programs are not created equally. And so as Dr. Levine was saying, I think it's really important that if we're going down the pathway of medication, just understanding that it's not at all uncommon to have to trial multiple medications. It's not at all uncommon to use multiple medications simultaneously. And sometimes we think, oh my gosh, multiple meds, like, wow, this dog must be really affected. Maybe yes, maybe no, right? If we're thinking about as the example that Dr. Levine gave of a dog who is 24/7 showing low grade anxiety or emotional distress, that animal may benefit from having a maintenance medication on board that facilitates training and learning across that 24-hour day, compared to a dog who is completely relaxed and soft and splayed out in the living room, unless someone puts their shoes on and gets ready to head toward the door, right? Those are 2 very different dogs. And so in the second case, if someone says, gosh, I can avoid leaving my dog home alone, except for every other Tuesday when I just have to go, well, then potentially leaning more on a situational or event medication protocol could be helpful for mitigating that animal's panic response. And putting something like quote unquote doggy Prozac on board, or the trade name Reconcile or fluoxetine on board for that dog who experiences very, very intermittent distress, is probably not the best tool, right? So we've got a lot of tools in the toolbox. We've got a lot of dogs in the treatment funnel. Which tools go with which dogs? And that's where working with really qualified, educated professionals can be super helpful. And whether that's getting in to see someone like Dr. Levine or myself, or working with a general practitioner who has a level of education, or at the very least is open to consulting with someone like Dr. Levine or myself, where we can hop on a quick 20 to 30 minute call and say, cool, tell me about the case you're seeing. Tell me how they've responded to those departure missions of the working with the trainer, and let's get some support on board for that. So those resources are available, and I understand they're not going to be uniformly or universally available to everyone based on location or timelines or budgets, but they're out there. So I want people to know that we've got options, especially if you're maybe sitting in that situation where you're thinking, well, I've already done everything. Mm-hmm. I guarantee you haven't. You may have done a lot, but I guarantee you've not done everything yet. And so I'd love to be able to, to put that sense of hope out there for folks. We've got options.
Yeah. And I think I would even push on that, because there was, on the flip side of that, there's always something else to try. So I don't want folks to feel like they have to go down a path like that forever if they've reached a critical point of like, oof, I can't do this anymore. But if you have not gone down the exploratory path of working with a veterinary behaviorist or working with a primary care vet who maybe loops in a veterinary behaviorist, that is a giant stone not yet overturned.
Yes. It's a big, low piece of hanging fruit that you have not touched yet.
Yeah. And then the other thing I would love to just on this front, so I loved hearing those experiences from both of you. And I think what I wouldn't want to create the impression of is, hey, if you're unable to suspend absences, go the medication route. If you can suspend absences, medication is never needed or recommended. Because Malena, I know that does not reflect your certified separation anxiety trainer's experiences. So could you speak a little bit about that?
Yeah, absolutely. I just loved listening to what both Dr. Levine and Dr. Pachel were just saying about using medication as an intervention. And one of the things that we do when we are tracking such extensive data about our clients is look at when that intervention of the first medication or next intervention of a multiple medication, and we track the exponential trend line that is occurring, and we're able to see what the medication, how the medication is affecting behavior. And I will say that even if you are suspending absences entirely, these dogs can greatly benefit from medication intervention. And one of the things that I think about medication intervention is that there's sort of three prongs to it that I think of. The first is gaining some purchase on the anxiety in general. But the other two are the ability for medication to enhance both learning and retention. And I want to lean into that for a second because, as Dr. Levine was saying, people are like, well, I don't want to just dope up my dog. I don't want a drugged up dog. And that is not the goal of medications that are used with separation anxiety. And we know that. Quite frankly, if your dog is acting severely lethargic and not responsive, that's not, I mean, I'm not a vet nor a VB, but that's not the right med, and that, right? Because that's not what we're looking for. And, but that enhancing of learning and retention, I think is really important because this is a slow process. This is a gradual intervention. And to be able to enhance that learning and also retention means we are not reaching for the meds that are making our dogs doped up and drugged out, because that's not the goal. So I really am so appreciative of working with people like Dr. Pachel, like Dr. Levine, like so many veterinarians and VBs that can be a part of this very collaborative team to be able to support the dog to the best of our ability. I mean, all of us have that same goal of not just supporting the dog, but also supporting the client in their efforts to get this resolved as quickly as potentially possible too.
Yeah, I think one of the biggest things that I want people, I hope, dog families who are listening to this is just if they're reaching out to a dog trainer or, who's going to say, oh, I can help you with separation related behaviors. I just don't want there to be this. Some people can become very dogmatic with their approach, that cookie cutter style. And I really just want the message put out there that, and I think we all agree, there's so many different ways you can approach this depending on so many variables. And that's the hope. That's the hope that's out there. It's just getting to the right resources to help.
Absolutely agree.
Yeah.
Mm-hmm. Yeah, absolutely. So we have a sense of what treatment or intervention can look like. Dr. Levine, you mentioned it very briefly in one of your responses previously, but I think probably people are really wondering, what's the success rate for separation anxiety cases? Like, is this something that you can fix or sort of eliminate, or is it something that you manage? And what do timelines look like for people? I know that's widely variable.
It's widely,
situation,
yes,
but
it's widely
ballpark.
variable. It's widely variable, and it depends on the dog. So I definitely have dogs where the clients pick up on the issue right away. They respond very well to behavior mods and meds. And if things are going well for 6 months, we can wean off and they don't need meds again. Those cases exist. There are also dogs where there is no getting off of medications. We are doing meds, we're doing behavior mods, and the dogs do so much better. And then we start to wean down off the meds, and maybe they get to a certain lower dose and things creep back, so they have to stay on a low dose of something. There are dogs where they do great with their separation anxiety, but common times for setbacks are when people have family stay, for an extended period of time. So now there's someone in the home a lot, or the owners go on vacation. And so we'll usually talk about common times for setbacks. And in my experience, I'll be curious to hear Malena and Chris as well, that if you have a dog who's pretty stable but has these setbacks, generally speaking, they can rebound from these setbacks much faster than what it took originally to try and resolve the issue or greatly improve the issue. And so sometimes that may just mean it's just going to take the dog a week or two just to get back into the schedule. Maybe you have to start over with the behavior mod process again, but it goes much faster. Or maybe we just have to, increase the medication a little bit for that setback. So some are cured, some are greatly improved, and some are just sort of hanging in there and managing and not in distress. Totally depends on the individual. That's my experience.
And if I heard you, thank you for that. And if I heard you correctly, Emily, because I know people do wonder. I feel like I heard you throw out the number of like somewhere around, I'm not holding you to this, like go through your records and tally up the math, but somewhere like 90% of cases do experience some notable amount of improvement. Yes. When it comes to separation anxiety. Did I hear that wrong, or would you like to add clarification there?
The 90% is the number that I used. And I throw that out there because my clinical impression for the cases that improve, not talking about a cure, but improve, are astronomically high, to the point where I say that because it is so worthwhile doing this treatment because it helps so many dogs. Again, not all dogs, but the vast majority of them. I love separation anxiety cases. I love them.
I love that you say that. And I think with respect to your question about sort of success rates and timelines, I want to also be a bit transparent, which you were as well, Dr. Levine, about, I know that collectively as CSATs, we've seen clients realize their goal in a couple of months, 1 or 2 months. Mm-hmm. We've also seen clients realize their goal in a year or two, right? Yes. And so I don't want to sugarcoat it and say, in 8 weeks, you're going to be putting on your dancing shoes and going to the local concert. Like, I don't want to pretend that that's the reality, right? But I do want to remind people that one of the things about behavior change is, and this is going to sound funny, so bear with me, but behavior change actually should be fast. And what I mean by that is it should be almost immediately. The reality, however, is that almost immediate change or changes are often very, very small. But the incremental change is particularly quick. And so one of the things that I think is important that we all do is celebrate those small incremental changes along the way. I think most dog owners will come into this saying, I need 4 hours, or I need 8 hours, or I need whatever the duration of time is. But if we can help them realize that behavior change really is happening, and it's happening fast. By the end of week 1, we've gone from a few seconds to a few minutes or whatever it is. That's fast progress. And we just have to be in it for a while in order to allow that exponential growth in duration to happen.
Well, I love that you brought that up. And I think that reflects our own sort of, we say like dogs are really good at telling you if something is actually working for them.
That's right.
It doesn't mean you get to your end point right away, but I think that's important for people to understand is if you are, say, that client who this is going to be a year-long process, it doesn't mean you're going from your starting point and nothing changes and then suddenly at a year.
Right.
Right? Like you're getting
100%.
to your dog's gaining confidence and ability, and you're gaining a little bit more freedom in your day and routine on an ongoing basis, or you should be. And if you're not, that's information that something needs to be adjusted.
100%.
Because to your point, dogs do learn quickly, and behavior change does happen quickly in small increments if we've figured out the recipe the way we want it to.
Right. And it's one of the reasons that I feel it's so important for us to be able to work so closely on, 5 days a week with clients, because we can collect that data and say, oh, behavior change, behavior change, behavior change, behavior change, or no behavior change, time to adjust.
Mm-hmm.
Yep.
And I think that's really critical in these cases.
I have a genuine question for Chris and Malena. What's your experience with, or impression with, if you can get a dog to be okay for like an hour? My sort of general, every dog's different, but general impression is if they can get to an hour, generally speaking, they're going to do well. If the people have to leave for 2 hours, 3 hours, whatever. But I'm just curious, in your experience, is that far from what you experience? Or maybe I'm having a confirmation bias here on my end. I'm just curious what your clinical experience has been, just to help educate myself on others' experiences.
I love this question, Dr. Levine and Dr. Pachel. I'm going to jump in first. Sorry, I just jumped in real quick, but I think we have to remember that progress is not linear in the sense that it's just not a straight line going up, but it is this exponential trend line. And what's so important about that is that those early stages of gaining seconds and minutes can be really slow. But as the dog starts to create the association of safety and comfort with alone time, it starts to grow much, much, much more quickly. I hesitate to say, the literature when I learned about separation anxiety, in my early education, people would say, if your dog can make it for 30 minutes, your dog can make it for whatever amount of time. And I think that's a little bit of a dangerous statement. But I do agree that if your dog can make it for appreciable duration, then additional appreciable duration is definitely on the table for that dog. I would not build up to an hour, let's say, for a dog and then say, your dog's fine, you can leave him for 4.
Correct.
I would
Yes.
still take some time, in between there. But I agree. If we've got a dog that can handle comfortably appreciable duration like an hour, the likelihood that they can handle considerably more is pretty high, but I would still take it gradually.
Thank you.
I would agree with that, and I think I heard that sort of within within Dr. Levine's response too, and that we're not sort of making an assumption that we hit a certain benchmark and now we've sort of checked the box on having successfully treated that issue.
Right.
I wouldn't say that I've necessarily looked at a particular goal as a measure of success. With that being said, as I was sort of reflecting on this question here, I'm like, okay, what would I tell my clients? I've told clients, maybe the first 15 to 18 minutes is often the hardest. If we can get through kind of that initial period of experiencing some degree of alone or isolation, then we're at least we've got some momentum, right? But it obviously depends on where did that dog start. Some of my cases start with actually 2 to 3 minutes is okay, but anything longer than that is a problem. So that looks different from the dog who is immediately in full panic mode the second somebody puts a hand on the door to leave. And so the thing that I'll often tell my clients is that if, wherever we're starting from, we may be making incremental changes 1, 2, or 3 seconds at a time. But once we get up to, let's say, 30 seconds, we're probably going to be able to make some increments that are more like 2 to 5 seconds at a time. And once we get up to 3 minutes, and these are just arbitrary numbers, so don't write this down and say it's a script or a cookbook. But once we get to 3 minutes, we may be able to make those increments in 15 to 30 seconds. And so I think that's that incremental trend line, Malena, that you're talking about as well, is that once we've got some momentum, the traction is there, we can make faster and faster progress. And the better we're able to avoid those panic responses in the meantime, while we're going through our missions, the better off we are, the more responsive we are to medication interventions or supplements or pheromones or any other supportive interventions, and the more committed those owners are to doing the homework. And if there are other adjunctive issues like situational anxiety or generalized anxiety, if we're also concurrently working on those issues, that may give us some more traction within the separation anxiety problem as well. And so, it's multifaceted. And then the last thing I want to mention too, especially when we're thinking about prognosis and kind of long-term success, is that I think we probably all would have experiences where a dog may come to us or is presented to us by an owner and they say, gosh, this has been a 7-year problem. It's been going on forever. And yet, with a couple of relatively insignificant changes, you've got a really flexible learner. And once we change the environment, physical or social, we see dramatic, quote unquote, overnight changes because the conditions are different and we've got a flexible learner on our hands. And so I never look at a case, even if it's been severe in its intensity and prolonged in its duration. I always tell my clients at that first assessment, I don't know how disciplined you're going to be, and I don't know how responsive your dog is going to be either. So let's start where we are, describe it as best we can, pick tools from that toolbox that seem appropriate for you and for your dog, and then let's evaluate in what seems like an appropriate time period. And I'm speaking in generalities there because if the intervention was a Prozac type medication, I may need 4 to 8 weeks before I'm evaluating effect. If the intervention was something like trazodone or alprazolam and a Xanax type thing, I might want to know where we are 3 days from now. If we're making an environmental change, such as getting the dog out of the crate, I don't want to know if that made a difference tomorrow. So it makes a difference as to the time period. But then I'm looking at, this is where we were, this is what we did, and this is where we are now. And that's where we start to get those trend lines. And that's the thing that I love about working with some of Malena's team, is that I now have visual graphical representations of what that actually looks like. And I can say, cool, what worked, what didn't. Where can we really lean in for additional effect, or what else do we need to be able to adjust? So as frustrating as it is to not be able to say, oh, this is a 3-month versus a 6-month versus a 7-year process, that's the reality, right? And I try to lead into that with my conversations with my clients too, is to say, I know I'm asking you to opt in for something that has a very uncertain timeline. And I understand how challenging and difficult that is. And I want you to feel free to express those frustrations and any sort of emotional reaction that you have to that the best of your ability. I don't know that I can fix it, but it's at least a space where we can talk through that and do the best we can to support you in the process.
Yeah. And I would say from, again, my more limited experience, and you all can just shake your head and say, take that back or cut it out of the episode. But is that I feel like probably a lot of behavior issues, there is some general kind of bell curve that maybe like the bulk of which starts at like that 1 month timeline and then cuts off at about 1.5 years. And like dogs are going to fall somewhere within that range. There's going to be some who make that overnight, like we got the meds right, you're fine, you're happy clam being left alone in a week. And there's other dogs who might take 2.5, 3 years, but generally between that month and 1.5 year time frame, right? Like you're going to fall in that window, and probably more of you might fall in that 3 to 7 month range, and more of you in that might fall within the 5 to 6 month range. So just to give people a very broad sense of, your dog can fall anywhere on that bell curve, and we won't really know until we get started, regardless of how intense the behaviors being displayed appear.
Yeah. And I just wanted to add there, like, because I almost want to ask everyone a question. If somebody was right in the middle of that bell curve, right, just to play devil's advocate, like, would it, like, I think I always tell people, like, again, you can be on the other end, all the caveats and everything. Generally speaking, with the clients we work with, in 3 to 6 months, they're usually in a significantly better spot for the majority of the clients. That's, I feel, again, you might not land in there. You also might be celebrating 2 weeks from now. But like, to give people, because I feel like if people don't have some sort of, like, again, like, what's typically, what does this look like? I think it's hard for people to choose to move forward with intention if there's not something there.
I often I love that you say that. When asked, how long will it take from a prospective client, which is probably the most common question that we get, I often say, I want you to think in terms of months, not weeks.
Yes.
But I also want you to think in terms of months, not years.
Love it.
Perfect.
Love it.
Yeah.
Wow,
great.
that's excellent. I'm stealing that. I'll give you credit anytime I use it with a client, but that's amazing.
Thank you.
Yeah, no, that's great. I appreciate that. I appreciate you all answering that question because I know it's a sticky one, but to your point, that's often what people are they want to know. They want to have some sense of what is this going to look like. So even having a range, I think, is really helpful. So I know we're coming up on time. I did have 2 more questions that we can all maybe try to keep as brief as possible. I know that's hard. One is, I know we spoke initially about the fact that sometimes there is a lot of time pressure to resolve some of these symptoms that are occurring, like vocalization in particular, with separation anxiety. And I think sometimes that time pressure can lead folks to consider options like maybe bark collars or other equipment that's sort of designed to like suppress vocalizations or discourage certain behaviors, maybe using like a really heavy duty crate to keep the dog contained to prevent, them doing like harmful escape related behaviors or things like that. Like what advice or counsel do you give to someone in that situation who maybe is like, look, I get it. I want to help my dog and I'm game to go through the process. But in the meantime, can I use a bark collar or something else to just make sure I don't get kicked out of my apartment?
This is
That's
a
a big
great
one.
question. It's a big one. And it's one that's near and dear to my heart because we talk to about 3 to 5 potential clients every day. We offer a free 30-minute phone or Zoom call for anybody that has concerns about their dog's separation anxiety. So you can imagine that we get a lot of people that we talk to. And this does come up. And one of the things that I want anybody to know is that these tools like a bark collar, a shock collar, a citronella collar, or like a high impact type of crate are not addressing the underlying concern and anxiety that the dog is having. And in fact, they are often exacerbating the problem by coupling a fearful situation on top of an already fearful situation. For instance, if we are talking about a bark collar, the dog is vocalizing for a reason. And if we're saying that, okay, all the differentials, it's not just I'm bored or whatever else, but if we're really talking about, and even for those situations, I wouldn't recommend it, but if we're really talking about anxiety, coupling anxiety manifestations with something that is scary, like a shock or like a spray of citronella in the face, is actually going to make the problem worse. And certainly for many dogs, it stops the barking in the short term, but that will actually manifest in other ways. And typically the barking or any other type of behavior resurges in a much more dramatic way. I don't think that we have to lean into tools like that because there are much gentler and humane ways of helping these dogs with a pretty debilitating issue. And so I really counsel people to understand that we've got to help that underlying problem.
I agree with all of that. Of course, thinking about that as an option and really coming into kind of why we would choose a different approach. I think the way in which I often talk through it with clients also starts from a place for where I get it. Their measure of success is tied to the observable behavior. And I think this is a piece that's changing where people have a greater level of understanding or awareness now that those the barking or the destructive behavior is tied to an underlying emotional state. But in that short term, we really just need it to be better. And so what I'll often try to do is to tap into that concern with the client and lean into that. I understand you need your dog to be quiet or you're going to get kicked out of your apartment. Are you open to exploring a whole host of ways to get your dog quiet? Can I accomplish that same goal that is what we need to accomplish. And here are the different ways that we can do it. What's available? What are the pros and cons? What are the timelines? And not turning this into a 17-hour conversation, but truly saying, again, this is the opportunity to say, can you avoid leaving your dog at home alone? Can you adjust your schedule? Can we really get them out for a ton of exercise? No, that doesn't fix separation anxiety, but it might, in some cases, make it a little bit easier to leave your dog for short periods of time. Can we use noise buffering devices? What's available, right? In a way that's unlikely to make things worse by trying to make it better. And even for the client who's really, really stuck on that, but I need my dog to stop barking, what I'll often let them know is, I need your dog to stop barking too, because that's going to mean that we've accomplished something that's meaningful for you. Are you open to reframing that in terms of kind of my dog is no longer barking and they are emotionally comfortable in this situation? Are you in alignment with me that that's also a goal? Because quite honestly, if a client says, I don't care about those other things, and again, this is exceedingly rare. Everybody has their dog. They love their dog. They want the best thing. And yet I get it. And sometimes when you're really, really desperate, there's that feeling of, in the best possible world, I want my dog to be comfortable, but right now I just need them to be silent. And so I want to give clients that space to be able to verbalize that so that they don't feel judged or criticized. And I also want them to know that we have options of accomplishing exactly that thing without making it worse by trying to make it better.
Yeah. Well, and I think that's like the important point for people here, because I would argue that a lot of times, especially for people who are coming to see us or who are coming to see any of you, they may even recognize, I get it. I know my dog is anxious, and it's not some internal like weird control need of I need my dog to stop barking. It's like, I need my dog to stop barking because I'm going to lose my home.
Yeah.
Right.
And I don't know what to do about that or how to navigate it. So I think in those situations, it's really important for people to hear, like, to your point, Dr. Pachel, and I think this is so important, like, we can prioritize how quickly can we make that happen in a way that doesn't, Malena, what you said, actually compromise our ability to help your dog feel better and improve in the long term, and it's not that, because I know there's going to be people out there who say like, well, you know what? I did put a bark collar on my dog, and legitimately, if you looked at a video of him 3 months later, like, not so anxious anymore. That can happen, right? Like, that can happen for whatever reason, because it just reduced arousal level. And the dog was like, okay, well, I'll go do something else. It is an exceedingly high risk strategy.
Yes.
And if it's not right for your dog, it can be really hard to claw back from.
Yes. Very.
So because we know there are other options that can work as well or better to help us deal with the barking in the short term, but that are so much better for the overall long-term progress and health and well-being of your dog, that's the reason we don't go down that path and we choose other ones instead.
And I love that you say that. And I'm actually pleasantly happy and surprised by the majority of people that I will just say, I have good news. We don't have to use that bark collar. And they go, oh, thank gosh.
Thank God.
Because I didn't want to do it anyway.
Mm-hmm.
Yeah.
I thought I might have to.
Exactly.
Yeah. No, I really appreciate you both sharing that. And I think the same advice and by the same token can be taken from that, like, put them in a really heavy duty, high impact crate or something like that, that just, if you even just sort of internalize what that might feel like for yourself in a moment of panic or distress, just how icky that might feel. But again, I get the intention. And I know how much people still love their dogs when they're considering that, like, well, I don't want them to bust through a window and hurt themselves, so I get that, but just knowing that there are other options out there, and the more willing you are to loop in like a veterinary professional, especially one who specializes in behavior, I think that world opens up a whole lot more quickly in terms of alternate solutions.
I think people are often just doing the best that they can, really, very bluntly.
Yeah.
Mm-hmm. Absolutely. So that I'm glad we talked about that, because I think it's probably something that a lot of people have questions about and think about. So all that said, What's the most important thing that someone can do to kind of get started if they're like, I think my dog might have separation issues? Like, what do I do? Where do I start? What's the most important thing or couple of things that someone should do to get the ball rolling?
Video. Start with a video. Yeah, start with a video. I know that sounds so simple, but gosh, the number of people that we speak with that say, I don't know, my dog's barking the whole time, or I come home to distraction, and we'll ask, do you know what your dog looks like when he or she is alone? And they'll be like, oh, no, never saw that before. And I'm like, wow, and that video can tell us so much. And we can look at that video and really ask the question of the dog in that video. Is this distress? Is this boredom? Is this frustration? Is this, all the potential things that can help direct the treatment options, whether that's with the vet or VB, whether that's with the training, or whether hopefully it's a collaborative effort amongst all.
Yeah. And I'd say to that, sometimes it's exactly as you described. Sometimes it's a kind of a more challenging situation. And sometimes we look at it and we're like, this isn't bad at all, actually, when we take a look at it. So, but getting that video, it can go in any of those directions. So I just wanted to point that out. And it's not uncommon to see that at all.
100% agree. And the thing I love now is there are some pretty affordable options for people. And if you're really stuck and you like, I don't have, use your phone. 10 to 20 minutes of video is a million times better than no video.
Yep.
So like you can set up your phone to record, and if you're leaving them anyway. But yes, video, I would agree. 100%. Well, that's all I had for today. I think we covered a ton of super helpful information for people. And again, I think key takeaways, this is an issue that absolutely you can see huge progress with.
Yes.
And even though it's really stressful and can feel sort of isolating and overwhelming, get some video and get started by reaching out to, a behavior consultant or a certified separation anxiety who leans into more positive reinforcement based approaches, and or to a veterinary behaviorist or a veterinarian who specializes in behavior, because there's a lot that can be done. And if folks would like to learn more about what you all are doing and stay up to date on your projects and endeavors, where's the best place for them to go and find you? Malena, we start with you.
Yeah, feel free to go to my website, which is my name, Malena, DeMartini.com. We'll probably put that in the show notes just so that the spelling gets correct. And I have a lot of free resources, blogs and interviews and podcasts, and there's so many free resources on the site, as well as being able to work with you one-on-one and offer that free 30-minute call to start to help guide people towards the direction that they need to begin. So I'm happy to talk. This is my passion. I've been if it wasn't my passion, I wouldn't be doing it 20 some odd years later. But, and helping dogs and the people that love them with this issue is something that fills my life with joy. And I want to be able to be there for people. And I want people to know that there is tremendous hope and there are tremendous resources out there available to you.
Fantastic. Thank you for that. Dr. Pachel, how about you? Where's the best place for people to keep tabs on your endeavors?
Yeah, a couple of different places. The first one, drpachel.com. So drpachel.com. If you go on there, basically anything that I've produced is linked to that site in some way, shape, or form. So on the media tabs, this podcast.
There's only like 2 or 3 things on there.
Yeah, just a couple of things there. So take a look. There's videos, there's podcasts, there's articles, all of those things on the media tab. That'll also allow you to link directly to the Animal Behavior Clinic's page, which is animalbehaviorclinic.net, which is where you can learn more about the services that we offer. If you're looking to loop in a vet behaviorist, we've got 4 docs on my team here in Portland. So if we're looking either to work with us directly or to incorporate our resources into the work you're already doing with your primary care veterinarian, all of that information is available there on the services tab. So those would be the 2 places, drpachel.com and animalbehaviorclinic.net. Socials are available too, but start with the websites. That'll get you what you need.
Perfect. And Dr. Levine, how about you?
Probably just going to the clinic website, animalbehaviorclinicnj.com, and you can see what we have available there.
Fantastic. Well, we'll put those links in the show notes. And again, thank you all so much for tackling this big topic in a way that hopefully gives people a whole lot of hope.
Yeah.
All right. We'll see you next
Well,
time.
thank you all.
Thank-